Today we have with us Dr. Nishanth Yagnick, who is a senior consultant neurosurgeon, who is currently working at Asian Hospital Faridabad and also visiting consultant at Paras Hospital. Dr. Nishanth Yagnick, welcome to National Specialty Summit.
Thank you. Thanks for having me.
It's a pleasure, sir, to have you today. The specialty which you are in, neurosurgery, it's always for the medical student something very complex to comprehend. So let's discuss more into that going ahead. So basically, to give an insight of the entire program, it's a program for medical students to get an insight into the career prospects, right? So as a medical students, we think that we know most of the specialties from what we have seen from our college, and we actually it's the practicality is missing. So in this idea is to talk to you and understand from your experience of life, and you've been through the entire thing and also practicing, so how the specialty is and what are the challenges, so that the students can make an informed decision.
So the challenges in neurosurgery are exactly because of related to the pathologies that we treat in neurosurgery. There are two essential main challenges that that students have to face. And in fact, for MBBS students, it's very useful because neurosurgery is one of those few 6-year courses that they can take directly after MBBS. So they need to make that decision immediately after MBBS during PG. Right. So the first challenge that you face is the challenge in your lifestyle. Because this is essentially an emergency branch, there's a significant component of emergency. You need to be, gung-ho and hands-on with being able to work at night at odd times. I mean, if there is a patient who is deteriorating, who you have operated, and it is your daughter's wedding, and that patient needs you, you need to be with that patient. There's no choice about it if you are the person on call or on duty. So there's no excuses with regarding that. And, in all surgery, not just neurosurgery, but essentially a lot in neurosurgery, there is something called the moment of truth, which is basically either you're going to know how to treat the patient or you're not. Excuses just don't work there, because it is a life-saving branch. The patient will come to you with a condition, and either you know how to save that patient's life or you don't, and you are the person who's there, and you're that gateway between, life and death. And that's why you need to be prepared at all times. At odd times, you had a fight with your spouse, your child is not well. It doesn't matter. At 3 a.m., if you're on duty, you have to go and you have to perform very, very diligently and scientifically. That's one. The second aspect of neurosurgery is it's also a good aspect and it's a bad aspect. The good part is, and if you understand, I think MBBS students will understand this once they do some amount of surgery, is that there is no concept of exploratory in neurosurgery anymore. So in the abdomen, in the chest, even in urology, you can have a look around and then decide what you want to do. But neurosurgery takes an enormous amount of planning and a preconceived understanding of what you're going to do. If you're going to open a tumor here, you can't open a tumor here and then decide, okay, well, I'm going to do this here now. Because that's obviously as grossly negligent, and it's not the standard of care right now. So it's that makes it a somewhat technical process and requires an understanding of both a good amount of neurophysiology as well as neuroanatomy, which is different from other surgical branches. So those are the two main challenges. Advantages are.
Yes, sir. So before we go with that advantages, so one question. So why did you choose surgical as a branch? So so when it comes to choosing either medical side or surgical side, so why did you choose surgical, and what made you to choose neurosurgery as a branch?
Okay, so I wasn't personally very hard and fast on surgery or medical side. Honestly, that's very strange because there are either surgical people or there are medical people. We think of it that way.
Right.
What happened was that you don't actually get a lot of surgical exposure in your internship. Very honest, you don't get that thrill, that feel of being a surgeon and doing surgery. So I was very inclined to take up a general specialty. I did not want to take up a early specialization like ENT or opthal. I was very into, I'll take general medicine, I'll take general surgery, and I'll see where I can go from there. So I tried actually both. I've done a lot of medicine, but in my PG exam, I took up general surgery for 1 month just to see if I like the feel of it. And in 1 month, I was sold. Essentially, that thrill of, a complete repair, a complete cure often is wonderful. You're doing it with your own hands, patient gets better. And that technical aspect, I was sold onto it. And then I realized that this is exactly what I want to do. That was the general surgery decision. The neurosurgery decision came after, at the end of my PG, and that was for two aspects. One, I wanted to work with the brain. You work sitting down with very fine instruments, with very fine work, with a microscope, and it is a mystery box. Essentially, the brain is a mystery box. When you open it, it is the frontier of science right now in all of medicine, and I sincerely believe that. I think to some extent, I wouldn't say to a lot of extent, but surgically to some extent, cardiac surgery, urology, these have reached their limit in one sense. The amount of research that is being done is good, but at one point of time, there's a significant amount of work already done. Neuro, we are nowhere near the limit. We are just scratching the surface of what we can now achieve with the brain. And that's why it has both aspects. Also, financially, it's a very good branch to take. So financial, research-based aspects, and it's not very hard to get through. I'm not saying it's very, very easy. There is competition, definitely, but not as bad as oncology or maybe urology, which and people throng into. So yeah, those three aspects made me take neurosurgery. It was a very calculated decision.
Wow, got that. So, and when you tell it's just a scratch which you're, what is the surface what you're just scratching in terms of neurosurgery, that makes us wonder, like, how long, how the way long we have to go to, get into the depth of the surgeries, right? So, now looking into the surgical field and also neurosurgical as a field. So, what do you see the advantages of it and also the disadvantages, of which you already mentioned some challenges, but some advantages of it?
So advantage, as a doctor, as any doctor, you want one of three things. You want to earn money. That's very important. You want a good life, good work-life balance. You want a research opportunity if you have that sort of mindset. Honestly, you don't know your mindset till you do it, very honestly. So neurosurgery will give you two of these three things. It will give you money, definitely, if you play your cards right. And two, it will definitely give you a good research aspect. And one very, very important thing that MBBS students don't realize, you don't want a shared branch. You want a core branch that no one else touches for a significant aspect of your bread and butter diseases. Bread and butter diseases are diseases that will give you that put food on your plate, essentially. So that's what happened with CTVS. Because cardiology and stenting took up a lot of CTVS practice, the bread and butter got sort of stolen away. So the amount of interest in cardiac thoracic, which was significant 40 years ago, everyone wanted to be a cardiac surgeon, has gone down significantly now. Whereas neurosurgery has gone up and up and up because no one will touch the brain but you. No one has the guts or the qualification to even comment on a CT scan, but you can open the brain. The spine is shared with orthopedics, but spinal tumors are not shared with orthopedics. So you are a more complete spine surgeon than any orthopedician in the country. And obviously you're a complete neurosurgeon. And neurosurgery is the master of trauma. You decide if the patient gets operated or not, because yours is the first priority. The brain is always first priority. That's why.
Right. So, any cons or disadvantages?
So the disadvantage I've already told you, one is the life. So I said, if you want a work-life balance, then it's going to be a bit hard for you. It's not unachievable, but in the early stages, you definitely do have to struggle a fair amount because of the kind of work. Later on, depending on your subspecialty in neurosurgery or your particular place of work, or whether you're an institutional practice or non-institutional practice, you can have a very busy life, a very sudden life, or a very controlled life. You go completely into spine, you're completely into elective surgery. If you go into deep skull-based tumors like me, then if patients deteriorate at 3 in the morning, 4 in the morning, no one else can operate them except the person who knows how to do it. So yeah, it's up to you. Still, the work-life balance is not as good as some of the fields like urology, plastic, or many of the medical fields.
Got it. So now, in your view, this specialty, like for whom this specialty would be an ideal choice?
Can you just repeat that? I think the screen hung for a second.
Yes.
Just repeat the question.
Right. So, in your view, for whom, what type of students or what traits in the students would be, which would be highlighted to choose this branch?
Yeah. So, if you are a dedicated worker, now see, every branch will say dedicated worker, but you need to be hands-on dedicated. If you're good with putting long hours, especially in the early part of your career, if your spouse isn't going to earn a lot, it might be surprising to a few students from MBBS, but as a neurosurgeon, you can actually build a solo career which can go fairly well. So some branches where you and your wife are working, or your wife and if you're the doctor and your husband is a non-medico or even a medico, in a much less earning branch, the peak amount of earning is not going to be so much. So two people can get together. But if you're the solo earner or you're going to be the main earner, then in neurosurgery, you can reach a fairly high peak. It takes dedication, but you can do it. And the second thing, that is the commercial aspect. Forgive me if I'm talking commercially a lot, but I think MBBS students really need to know. They're very, not versed with it, and I want to tell them the things I wish I had known in my MBBS. So, and as the second thing, you need to love working in complicated structures and study a fair bit. Not as much as maybe medical neurology and all that, but you have to be able to study a fair bit because operating in the brain, you need to localize things extremely well anatomically. So you need to study a fair bit of amount to be able to, be a good neurosurgeon. Yeah, and you have to deal with a lot of ragging. Yeah. Essentially, you need to have a slightly hard personality. People who have left the residency course, I have friends who have joined residency, they've left residency. Those people have generally been a bit more, I would say, difficult. They find it difficult, hardship and difficult people difficult to bear. So you have hard taskmasters in neurosurgery, and that's been going on since Cushing. It's been going on since the father of neurosurgery. They're grade A type personalities, very tough to work with. But that's the nature of the profession. Essentially, we deal with life and death, so you have hard masters, and yeah.
Yes, got it. So when you mentioned we're looking into more of monetary, but of course, so that at the end of the MBBS, once they get into all these things, the finance is one which is very weak for doctors. We don't know how to manage and handle and look into, because never we dealt with that. And suddenly you are into the real world, looking into different financial aspects and deals and a lot of proposals. So it becomes hard. So that's one of the areas which we'd like to know early, get involved into, so that they get an idea of what's going to happen in the real world. So thank you for adding that there. Right. So now coming to the neurosurgery, right? So still there are specializations which you can do after that.
Yeah, so you can do subspecializations, but I'll be very honest. The neurosurgical culture outside of India, for example, in the US and particularly in Japan, which are good neurosurgical centers, there is a significant subspecialization culture. So if you're doing, let's say, vascular neurosurgery or aneurysm surgery, you're going to be doing aneurysm surgery your whole life. You will leave out the other surgeries and you will be given patients of aneurysm surgery. But in India, now there's two aspects. There is the government aspect, public hospital aspect, and then there's the private hospital aspect. In public hospitals, in big institutes, PGI where I'm from, AIMS, NIMHANS, these kind of institutes, you can still pick up a subspecialization and continue in that. And you can become a national authority in that over time. But in the private aspect, you have to essentially do all neurosurgery, because right now we have so many patients and so many varied patients that you'll just have to do them. You won't have a choice on the volume. And slowly it's changing though. I think I'm predicting in the next 20 years, we'll have significantly subspecialized neurosurgeons, vascular, pediatric, oncology, neurointervention, neuroradiological intervention neurosurgeons, hybrid neurosurgeons. All of these will become, very common specializations, and people will choose those neurosurgeons essentially.
Right. So essentially, people are getting more knowledge because of all the internet things, and people are also searching directly for a neurosurgeon, and all kind of instead of going in a paced manner, right? Okay. So now looking into the career aspects, right? So what are the career opportunities after surgery? Of course, we know, but after neurosurgery. So how do you see the career aspects in India and abroad?
Okay, so first in India, it depends on whether you're a government person or you're not government. See, either you are a person who wants to work in a public hospital or you're not. If you choose the life in a public hospital, right now, the number of AIMS that are being built, the number of new hospitals that are being built, all of them need a neurosurgeon. For the next 15 years, neurosurgery is in a boom. I'm predicting that 15 years from now, neurosurgery will get saturated with neurosurgeons. But for now, it is in a significant boom. And that's for two aspects. One, newer centers, easier equipment, better microscopes. So that's one, and that's in the public sector hospitals. In the private sector hospitals, it's in a boom because of national highways. Interestingly, about 3 years ago, I was in PJ Chandigarh. I used to travel to Delhi very often. There were two hospitals between Delhi and Chandigarh. That was on the main highway, the national highway. Now there are five in a matter of 3 years. Each hospital needs a neurosurgeon. So you can imagine that everyone gets placed. And in the periphery right now, there is such a lot of growth for neurosurgery and such a lot of demand for neurosurgery that in the periphery you can start building a wonderful career. It's very competitive in places where I am, like Delhi NCR. You need a special set of skills to survive and do well and build a career. But even here, it's not like any other branch. It's right now growing very, very rapidly because of the absolute base need of surgeons. So now people are not actually going out of India. As opposed to other branches, once you take neurosurgery, the packages of neurosurgery that you get in India and the amount of patients you get, the respect you get, is equivalent to Middle East, not so much to the US, but you have to understand that to go to the US and become a neurosurgeon, you have to do it from your PG, and it's hard to get a surgical PG in. That's a whole different lecture, and I'm sure there are people on that.
Yes.
Outside India, the three countries that are taking neurosurgeons right now are the US, the UK, and Australia. And Germany has recently opened its gates to neurosurgeons. But there are very few neurosurgeons who've become neurosurgeons in India and gone to Germany, right? The US, there are a decent number, but to get into a US program, you need to work there in a non-clinical fellowship for 2 years. People have done it. I know people who have done it. So it's a bit hard, but it's not impossible. UK is very open to neurosurgeons right now. If you want to migrate as a neurosurgeon to the UK, it's very easy. It'll take you about 1.5 to 2 years. You don't really need a GMC registration. You don't need to give your PLAB. You will get your registration on the basis of your FRCS, and you have to clear an IELTS score. And there are some programs in NHS called the ISTP programs, International Student Training Programs. And these are absolutely calling for neurosurgeons because after Brexit, right now, UK has lost a lot of their European doctors who want to go back to the European Union. And because of COVID, they started to realize that they have a dearth of surgeons. But the problem with the UK is somewhat different. You will be a registrar in the NHS for at least 6 years before you become a consultant, if they want to take you. And so there are registrars who've been registrars for 10 years almost without becoming consultant. That's for every branch in the NHS right now. But the demand for neurosurgeons is high.
Right. So now, with all these things discussed, the finance again, we'll come back to that. So what would be the earning potential? So if you can put it in some numbers from initial, as soon as you become a new surgeon, and then going towards what would be a range, what someone can look forward to.
I'll give you exact numbers. I now have enough experience, and so many people have gone through the. I'm part of the training program for the DNB students in Paras Hospital. I've trained 6 residents till now. So I know exactly where they're going and what they're doing. So if government side, obviously standard salaries as opposed to everyone else, UGC based grant salaries. Private, South Indians don't want to get paid. I mean, very honestly, I don't know why they undercharge for their work. And a starting attending consultant would get something like 1.25 in hand. I would say that South Indians should get together and just say we want to charge more. Okay, so that is the main cities. I'm talking about Hyderabad, Bangalore, Chennai, center of Chennai, big corporate hospitals. You'll start as an attending consultant without OPD, OT rights. You start learning the work with someone senior. North India, same thing. You start off with 2.25 in hand. It's a 1 lakh jump. In Delhi NCR, we pay our attending consultants 2.5 in hand. And that's a 10% TDS professional contract. So you get 2.5 in hand from your 2.75 salary. Ours is one of the best paying centers, even others, but you'll get anything between 3 or between 2 to 3 in North India as attending consultant. If you move out, attending consultant is basically you are working with someone else for someone else, essentially, right? So you're doing surgeries, but you're under someone famous surgeon, some leading surgeon there. Now, as soon as you move outside of the main cities, even on the outskirts, you will start with salaries of 4 to 4.5, 5 lakhs in hand. In Cathal, my batchmate is started off with a salary of 4 in hand. Now he's making 6 in hand. With cuts and incentives, within 2 years, he'll make 10 plus. In Jamnagar and Rajkot, because of one of my batchmates who was a local there 3 years now, he's making 13 lakhs in hand, and that's just without cuts. In the Northeast, you can set up your own hospital within 3 years with the amount of money you're going to be making. There are very few neurosurgeons in Tripura, very few. Assam has a good number of neurosurgeons, but Tripura, Mizoram, Meghalaya, these states are highly deprived of good neurosurgeons, qualified neurosurgeons. So there is, in the periphery, there is a significant amount of money starting now, right now. 5-10 years from now, I have a feeling this number is going to significantly reduce, because we are essentially making 300 neurosurgeons a year. That's the present seat intake, including DNBs, 250 to 300.
Right.
And the top limit is, there's no limit. Even in Delhi NCR, in Hyderabad, there is no actual limit to how much you can make. I can assure you, my boss in Paras, who's Padma Shri V.S. Mehta, he was director AIMS, retired AIMS. So yes, big personality, one of the top neurosurgeons in the country. He's one of my mentors. He is making, and on an average, pre-COVID, he was making probably 30-40 lakhs per month. I know the values now because I'm a senior consultant. So there is no limit to the amount of money that you can make. But, it's all part of how you live your career and what you want.
Right, got that. So now with all these numbers, so how do you see the work-life balance as? Like, no, yeah.
So neurosurgeons have a personality type, and if you're not that personality type, you'll become that personality type after 3 years. So we are workaholic by nature. I'm telling you, even if you're not workaholic, 3 years after a good neurosurgical residency, you'll realize that you cannot be casual in your approach in neurosurgery, because essentially in neurosurgery, patients die, or they become hemiparetic, or they lose their vision. These are very, very, dangerous and debilitating complications of a casual attitude in neurosurgery. In the beginning, it's a bit of a struggle. So you can start off with an institutional practice, work for 3-4 years in a government hospital, lots of numbers, but a good life. And then you can come into the private side. As soon as you come into the private side, it's a decent amount of hustle. So you can, if in the periphery, you can have a very chilled out life. You can work 4, maybe 5 hours a day, but there'll be night calls. Definitely there'll be night calls. You'll have to see them. You'll have to operate at night. In a busy practice in a metro city, you have to work anything between 8, maybe 10 hours a day. And besides that, there'll be night calls. So we calls at night, emergency surgeries. And surprisingly, I haven't seen anyone complain. No neurosurgeon complains about the work hours. Once they're into it, they actually fairly love operating. They don't think that the workload is ever enough, ever.
Got it. Right. So in your view, looking into the next 5 to 10 years, so how do you see the neurosurgery branch growing in the future?
So I see the neurosurgery branch growing in the exact same. I was just telling you that there are more and more hospitals coming up, especially on highways and in small centers. See, from the public hospital aspect, AIMS, as you can see, it's coming up, it's mushrooming everywhere with the new AIMS. The same thing is going to happen with centers like PGI. For example, in Bathinda, the new AIMS being built is actually being held by PGI Chandigarh. So institutes. And the second thing is smaller hospitals, so for example, government hospital, Chandigarh 32 sector. Good hospital, never had neurosurgery, now has neurosurgery. Sher-e-Kashmir has a neurosurgery program, is tripled in the number of OTs. So there's a significant growth because of significant demand among patients. In the private side, there are 2 kinds of growth that are happening. The first is corporate conglomeration. So neurosurgical faculties are forming companies and they're outsourcing their work to multiple big hospitals. So corporates wise, the neurosurgeons themselves are actually forming companies. And outside of corporates, slightly periphery tier 2, tier 3 cities, the old nursing home concept is now converting into a corporate concept. People who were running nursing homes for almost decades, they have a house on top, then they have their clinic below, and they were happy with that kind of life. Now the population has started to demand a slightly corporate look. They want that kind of good room. They want those services. And when you get together and open a big hospital, you need a neurosurgeon. So like I said, 10, 15 years, it's a boom. It's a massive boom. 15 years from now, I have a feeling it is going to saturate.
Right. So we discussed a lot of things in terms of how academically and what will be the future of neurosurgery and things like that. So now we'd like to know more about you and your journey from the days of MBBS, how it has been for you, and what made you some snippets there, and to know how your journey has been the PG and then the neurosurgery and super specialty. How is your residencies? So if you could just take us through the journey, it would be a great to know the journey.
Thank you. So I did my MBBS from Manipal, Karnataka. So Swalpa Swalpa Kannada. And I was brought up in Andhra and Vizag. So Koncham Koncham Telugu. And with that background, I've spent the first 24 years of my life in South India. I love South India, miss it a lot. And Manipal was one of the best places to do MBBS, both in terms of your life and in terms of personal life, in terms of teaching. Such dedicated teachers. I'm telling you, I've never seen such dedicated teachers in any profession, any college other than Manipal. And that's true for a number of South Indian colleges. They're just pure dedicated teaching. And during my MBBS, I developed an interest in the neurological system. Definitely. I was very interested because of the same thing. It's a frontier. I have a research mindset. I've done 25 paper publications, 3 books, multiple chapters, my own books, my own historical books on neurosurgery, and the neurological system always perplexed and intrigued me. So, but the decisions to take. I've already mentioned the decisions that I used to take my career path. When I got into PG, RML Hospital, Dr. Ramanollaya, PGIMR, PGIMER is a national government hospital, and it's at the center of Delhi, heart of Delhi. And again, very good place. We had a very home environment. My PG was very nice. My mentors in general surgery treated me like family, and that was the general feeling. So over there, I didn't enjoy gastric surgery so much. General surgery first year is obviously it's wonderful, and I enjoyed doing surgery. I love doing hernias. I love doing lap choles. We did as much as we got to do. Emergencies, I loved emergencies, and that's what I realized I can be a neurosurgeon because I love going the thrill of it, just the absolute thrill of going and saving a life in the middle of the night. I loved it, So that was good, but I didn't enjoy working with the GI system so much. So one of the inspiring personalities in my 1 month posting in neurosurgery was Dr. Bhaskar. He was Sri Chitra trained, and because of his meetings with his residents, which I attended, I fell in love with the diagnostic aspect and the treatment aspect of neurosurgery, and so that was my decision. But my first exposure to neurosurgery practically was after PG. I did 1 year of non-academic SRship in Lok Nayak Hospital, Maulana Azad Medical College, one of the best hospitals, known hospitals in the country. It was a very tough working environment. The hospital was very understaffed. The equipment was just very, very low level, and but it was my first exposure, and you had complete freedom to explore the field at your level. It was you're left independently. There is actually no one at that time. Now it's developed significantly in the last 6 years, 7 years, I think it's been. But at that time, it was left to us and saved a lot of lives. It is a very morbid field in the beginning. You look everywhere and you see a lot of young children with tumors. It's a bit depressing. You think you're intervening and nothing happens. And I'll tell you a good incident. So 1 week I was very depressed. I'm
Okay.
working as a neurosurgeon at night. There are 15 emergency beds and 40 patients. So there are 2 patients of trauma who are comatose lying opposite each other. Children with hydrocephalus, 3 patients on every bed. And it was a very difficult environment to work in. General surgery has much better results, I thought so. And then there's a condition called chronic subdural hematoma. And a patient came in with, I think it was left-sided hemiparesis, is almost 0/5 power, barely any flicker of movement, altered sensorium. I don't know how much of GCS that the MBBS students listening will understand, but he was M5. And I took him to OT. I made 2 burr holes and I drained the collection. The next morning, his hand was working normally. He was folding his hands and he was telling me, "Thank you, you saved my life," with his words. This is a comatose patient. So chronic SDH is one of those conditions we've operated on time, like extradural hematoma, chronic subdural hematoma. These patients recover rapidly. And that was my first exposure. And I said to myself, this stuff works. Okay, this is not me trying to fight against nature. This is me fighting against nature and winning in a good number of circumstances. Then I went on to PGI. PGI is one of the toughest 3 years of my life. I think I won't ever have the guts to do that again. It was army level training, both in terms of the surgery, the residency, dealing with 14 consultants, 30 residents. When you join, there are 30 seniors. And in 3 years, but right now, thanks to Dr. S.K. Gupta, the HOD presently, I came out tough. I mean, I think residents in PJ right now, I think PJ is the best institute at present to do your neurosurgery residency, because you come out tough. You come out surgically extremely well trained, conceptually extremely well trained, which is missing in a lot of smaller hospitals and centers. And you come out with an understanding of how the patient can catch your neck if you do the wrong thing. And that's very important, because you need to justify with scientific practice, modern scientific practice. I believe patients deserve the justification. You can't say this person is anymore, that this person is not educated, I'll pass off anything as surgery. That is my belief. I believe that you need to give them good, scientifically sound care and a very, very gentle touch and a gentle tone, so that, because these diseases that we deal with in neurosurgery are fairly morbid. So PJ was tough, but it trained me extremely well. And I've gone from in Loknayak doing decompressive craniectomies in 6 hours because of the instruments there, to doing a decompression in 20 minutes with a power drill in my hand. So that's the difference in 4 years of training. And then 3 years of, being a senior consultant, then a senior consultant. And skull-based tumors are just magical. It's tough. It's very tough surgery, but if you get it right, it's a wonderful feeling. And this is something Harvey Cushing, the modern father of one of the fathers of modern neurosurgery, he said there's no greater pleasure in surgical challenges than taking out a skull-based meningioma without any deficits.
Wow. That's been very inspiring journey to listen to and look into. So thank you so much for sharing that in very very detailed things. So now looking into your career for all these years, what has been the challenging part of your journey?
Yeah, so when I stepped into the private sector, the struggle initially in a competitive sector is they don't really care. Patients don't know how good you are. No one knows if you're a good surgeon or not. How will they know? How will someone who's living in Delhi know what PGI is, or what your skill level is, or what even a brain tumor is? The patient who is lying down with a small tumor next to a patient lying down with a big tumor, they don't know. You've operated a big tumor and with only slight hemiparesis of the face, and someone has operated a small tumor perfectly fine. The person with the small tumor will say that, this surgeon is better. My surgeon was better because, yours gave you a hemiparesis. Your face is distorted, and they don't understand. So you can't expect them to. So the aim right now, and I think this is the difficulty with all modern doctors, that it is not enough to be a great doctor anymore. Not in a competitive metro area, at least for now. Not in neurosurgery, not, and in fields like ENT, any area you have competition. So my main challenge was at a young age to convince people that I am the doctor for them. And because of that, and then what happened was, my biggest challenge came that when I was promoted to senior consultant, I'm the youngest promotion to senior consultant in the history of Paris Neurosciences. And that was by my mentor, Dr. V.S. Mehta. And he saw the potential in me. But as soon as I was promoted, the first lockdown hit. And as soon as it hit, in the private sector, you have to prove yourself. You have to justify your salary. And I believe you have to justify it in the right means, not in the wrong means, if you know what I mean. That requires you to really market yourself. But how would you market yourself? Pamphlets, they don't work. I tried everything. Newspaper articles, magazine articles. If you see my website, you see my resume, you'll see my writing. And I tried everything, but patients didn't come. You need to tell them that you exist, and you need to tell them that your skill level, and you need to show them that you are a kind and gentle person if you really are. So that's when I started digital marketing. I started reading, I started seeing YouTube videos, I did courses, but digital marketing was not meant for an Indian medical market. Whatever courses I found, they were meant to sell cakes, they were meant to sell, everything else, not for medical. I went to a marketing company. I said, market for me. And they charged me a bomb. They said they'll make my website in 25,000. That's the present going rate in most cities. For a few Facebook posts, they charged me 75, 80,000. It didn't work. Patients didn't convert. And so I took it up myself. I started understanding what a digital ecosystem is. And this is where the senior surgeons and myself, we have the difference. The young person is ready to struggle. They're ready to move around and they have the energy and the fire in them. So they need to be able to put themselves out in front of people. And believe me, the right price package, people will come to you. People will believe that you can cure them. So word of mouth is very slow. Everyone depends on word of mouth. But if you don't put yourself in front of people, and that's when I started digital marketing and I started teaching digital marketing to my juniors. What started as simple, classes, build your website on Wix, build your website on WordPress, just this is so easy. Why are you paying people money to do this? And then finding your USP. I had friends in other departments who were saying, how can I compete with someone who's already established for 10 years? I said, this procedure better than that person. You have a better qualification. So you talk about it. So I made them make videos and put the videos up online, not even on YouTube, on simple things like Facebook. And then Facebook marketing, Facebook business marketing with ads. And then I developed a funnel and I started getting patients in. And now I have a steady stream of patients from online consultations to physical patients to peripheral OPDs. The funnel has worked and they convert. And once they convert, it justifies everything. So that's why I started the Power Course. I've already mentioned it to you that I teach a digital marketing course to doctors of all specialties. I've been doing it for the last 7 months now. I have something to the tune of 78 subscribers from various specialties all over the country. They all contact me for their challenges. They're starting nursing homes, practices, and it involves understanding digital marketing and understanding the practical challenges that you face as soon as you come in. You don't know what panel mechanisms are. You don't know what insurance mechanisms are. You write the wrong thing. Patient can't claim their money, and you can't say the wrong things to the management. How to understand contracts, taxation. They don't know this. So the Power Course is my website, getthepowercourse.com. It teaches you this at a very affordable price package. It's a passion thing for me, so I just give it out to doctors.
Yes, I know. No, this is something very interesting. What no, you have come up with, and it's not everyone. So I could see that, like, no, we don't have no many people who are entering into this domain. And with the current no technology world, everyone is having a smartphone and a 3G, 4G, which is coming up. So technology is where everyone is moving towards. And from the health sector, as you rightly said, we don't have that system of digital marketing which is currently existing, which can allow the patients. And again, there is some types of what is it stopping ourselves going in front of the cameras and also to the people. So a lot of, again, negative thoughts and processes are also there, which has to overcome. But yeah, so really no, it's really commendable that you have started something, very strong initiative, and we all wish all the best for, so let it go in a big way, right?
Thank
So
you.
with that, yes, so it's something very new and innovative. Thank you for sharing that too. And with all these years of, again, learn hardship and which you've gone through and what you mentioned, so what has been the best part of being a neurosurgeon?
The best part is the cure aspect. I mean, if you don't love it, then you can't be a neurosurgeon. So saving a life, essentially, it's a life-saving branch. Just day before yesterday, child came to me with infection, ventriculitis, significant ventriculitis, treated in a peripheral hospital. Someone was giving that child antibiotics for a very long time, but the child definitely needed a drainage and the child was unconscious. And amazingly, children have wonderful neuroplasticity in their brains. Wonderful. Up till 7 years of age, a child with almost a complete hemispheric infarct can develop good neural plasticity and can develop good growth and live fairly normally. Even that child can fill a fairly normal life. So this child, thankfully, in children less than 18 months of age, the anterior fontanelle is open. So what happens is the bones have not fused yet. So you have a direct access to the ventricles of the brain. So under neuronavigation guidance, we have neuronavigation guidance here, which is basically 3D measure in real time to see where you are putting a needle and to direct it into a 3-dimensional space based on coordinates, predetermined MRI. So we did that. We took out the pus. We took out a lot of ventricular fluid, and the the child is almost completely normal now. It took antibiotics, and the child will be on antibiotics for a while. But this child who was not able to feed, completely vomiting, and sunset sign, could not look up. The child could not look up complete at all. Child was always looking downwards because of the pressure in the brain. That child improved. I did a lot of black fungus cases in the last month. I mean, sad to say, but I'm good with endoscopy, so I'm one of the sought out endoscopic surgeons, neurosurgeons. So a lot of ENT guys made a lot of practice this time. They were getting a lot of black fungus cases, but these black fungus cases, I'm sorry, I'm talking to MBBS students. So mucormycosis, essentially. So mucormycosis, the rhinocerebral aspect is significant. And a lot of these patients, they present, and including my friend who's an anesthetist. I've worked with him for 3 years. His wife, she's 7 months pregnant. She got very bad COVID, went on steroids, survived, and then she got mucor. Survived because after 3 surgeries, me and the ENT surgeon, we went and debrided all the way up till the frontal, the basal part of the frontal bone, and prevented CSF leak. Did a lot of work, and she survived. Some patients have not made it, sadly. Did a lot of mucormycosis, excisions, drainages. So yeah, that aspect of seeing my friend's wife survive because of my efforts. That's the reward. Yeah. I recently went for her baby shower, so that was even a bigger, bigger reward.
Right. That's great. That's great. So, Dr. Nishanth, we are almost at the end of the discussion. So, what would be your guidance for the young doctors who are inclined to take surgery, or someone who's looking into neurosurgery as their future super specialization? So, what would you say for all the students?
So if you are not decided on your branch, do take up general surgery. But my advice would be that if you think you would like neurosurgery, talk to neurosurgeons, talk about their life, go visit every neurosurgeon loves to be appreciated. Listen, everyone loves to be appreciated. You tell them that I want to see the surgeries, I want to see work, I want to be around a neurosurgeon for few days. Do that. I did that. I went before I did surgery, I actually went to a family friend in Puttaparthi, Andhra Pradesh, and he had Anantapur basically, and he had 2 hospitals, and I worked with him for 3 days before I thought, I'm going to take this branch and see the life. It's good money, challenging, not very hard to get through, not very easy, but not very, very tough. And you have to enjoy life-saving and emergency aspect. Take neurosurgery if you are ready to be up at night to save a life. It seems very easy at first, but as you get older, you start losing some hair, start getting white hair, it starts getting a bit tougher, and some sacrifices have to be made, but the family always understands. That is my advice. Take a 6 years course if you get it. If you are sure about neurosurgery, avoid the super specialty entrance exams. So take the 6 years course. But if you can't, do general surgery and enjoy your life. Enjoy your residency. Enjoy medicine. If you want to make money in life, do an MBA. Like honestly, if you want to make money, you can also do neurosurgery. But trust me, it's not going to work if you don't enjoy doing the neurosurgery and then you want to make the money. It's not going to work. You need to love it. You need to love it with all your heart. Otherwise, what's the point?
Wow, that's a great message. Love what you do, and because you love it, you join them, right? So, and thank you so much. It's been very inspiring to have such a detailed discussion with you, and it's very rare to come by such an humble. I would really appreciate that, and with our one call that we want to have a discussion on this, so you really jumped in and you gave us such a valuable time to discuss today. With I think this really would help a lot of students across India to make an informed decision on what we have discussed. So thank you again, Dr. Nishanth. Thank you again.
Thank you, Dr. Sajjan. I'm telling you, this is one of the best initiatives I've ever heard of. I'm telling you, I really wish I had this kind of access when I was doing my MBBS to guide me. And what your initiative is commendable. It's wonderful.
Thank you. Thank you, Dr. Nishanth. Yes.
Thank you.
Isn't this valuable?